I just want to remind everyone when we look at the payment structure for meaningful use that the payment years for eligible professionals begin in calendar year 2011. So they can begin as early as calendar year 2011. That's January. Fiscal year 2011 is October for hospitals and critical access hospitals. Our incentive years, when you look at the structure for both Medicare and Medicaid, Medicare incentives, of course, run from 2011 to 2014, with Medicaid beginning implementation in 2011 and running from 2012 to 2013. The final rule for meaningful use, we did see some notes regarding payment adjustments. There will be a reduction in reimbursement for Medicare for those individuals that are eligible professionals and are not demonstrating a meaningful use of certified EHR technology. They'll receive a reduction in their Medicare payments starting in 2015 by 1%, then escalating from that, 2016 at 2%, and 2017 and beyond at 3%. Of course, Medicaid does not have a reduction in the reimbursements. One thing with becoming an eligible, meaningful user, we did see change that if a provider begins demonstrating meaningful use in calendar year 2013, begins to be paid, they need to demonstrate those objectives for the first stage 1 for 2 consecutive years. Even though they're late in the process, HHS wants them to demonstrate those objectives for 2 consecutive years instead of 1 and then jumping to stage 2. HIMSS is going to have some more detailed information on an analysis and summary of the final rules. Outside, we do have some of that information that's out already, so I urge you to pick that up. Before jumping over to Joel, I also want to announce some information that was released yesterday by HIMSS Analytics. And HIMSS Analytics is a research subsidiary of HIMSS. And what HIMSS Analytics has been able to find that we've seen a steady increase in adoption of EHRs among hospitals over the past 4 years. And we know this through a tool that HIMSS Analytics has. It's the EMR adoption model. Basically, it tracks the progress of EHR adoption among all U.S. civilian hospitals in the United States. It's about 5,217 hospitals. What we do is we track the adoption levels and score the adoption based on 7 stages, from 0 being completely paper environment to 7 completely paperless. And right now we're able to tell that about 16% of hospitals are right at our stage 4. And what does the stage 4 mean in our EMR adoption model? Well, we looked at our draft rule before the final rule around meaningful use. And the draft rule really did align with our stage 4 of our EMR adoption model. And that means a system has to have clinical decision support and CPOE capabilities. So we need to do a comparison now that we have the final rule, but we anticipate it to be even higher than that 16%. That being said, when we looked at the draft rule, stage 3 of our adoption model had about 50% of hospitals. So that means 50% of hospitals at the time were gearing up to meet really that first phase of incentive. So we're anticipating much progress on this and looking forward to working with the community and rolling out the final rules. HIMSS is going to have a number of webinars, and if there are any congressional staff in the room, I'm happy to help plug you into some of that information, and our summaries out on the tables as well. Joel?